Welcome to Joy in Our Town. I'm Lisa Boldo, and we're talking about health. Joining me today is Dr. Reid Winick, founder of Dentistry for Health New York here in New York City. Thank you so much for being with us, Dr. Winick.
It's a pleasure to be here. Thank you.
It's a great topic, the dentistry. So we're going to just dive right in.
Great.
Tell me, what is sustainable dentistry?
Well, Lisa, sustainable dentistry is a new model of dentistry where we look at the mouth and the rest of the body as a whole. And what we've discovered is if we follow these sustainable principles, the mouth can actually heal on its own.
Wow.
Yes.
That's pretty amazing. So how or why was sustainable dentistry developed?
Well, about 30 years ago, I was diagnosed with Crohn's disease, which is a chronic inflammation of the small intestine. And over that next 15 years, I was very sick. I had numerous surgeries. I was on disability, and I was bound to have more surgeries. And whatever I was doing, the conventional medicine wasn't working, and I had to find a better way. So luckily, I stumbled upon these sustainable principles. I applied them to my own health, and over the next few months, I regained my strength. I no longer had a chronic infection in my intestines. I was able to go back to work, and I became very healthy. So then, over the next 15 years, I started to put these same sustainable principles towards my dental patients. And I saw that by applying the principles, we get more healing and better recovery from the diseases they have in their mouth.
So specifically, what would be the difference, say, between sustainable dentistry and regular dentistry?
Well, there are a number of different categories of dentists. You've got your regular dentist, like your drill and fill dentist.
Yeah.
You've got your dentists that do gum surgery, cut away the gums. You have your dentists who do aesthetics. They don't want to put the gray fillings in. You have your holistic dentists who do proper, safe amalgam removal. Then we have sustainable dentists who understand that, well, if we take a more proactive approach and not be reactive towards the disease and try to incorporate these principles, the body will benefit and so will the mouth. You know, so if we follow these sustainable principles, let's say to the earth, right? If a tree doesn't get the proper nutrients it needs, if it doesn't have the right minerals in the water, what happens? The tree starts to break down at the top of the leaves, right? Top of the tree. Well, the earth is an ecosystem. Well, the body is an ecosystem. The mouth is an ecosystem within the body. So if we give the body the proper nutrients it needs, what do we see? Well, the mouth will start to heal first. Contrary, if we take away the proper nutrients, what do we see? We see the mouth breaking down very early on, and the mouth is like a barometer for your overall wellness. So we can open the mouth and take a peek inside. I can't open up your stomach and take a look inside. So it gives us a foundation for good nutrition that could possibly be deficient with the patients.
That is super interesting. So how can someone minimize the diseases associated with the oral cavity?
Well, you know, good nutrition in the mouth is almost the same as good nutrition for the rest of the body, okay? So we talk about having, eating the right foods, getting the right amount of water, taking good nutrients and supplements, exercising, getting enough sleep.
Yep.
All these factors help with the overall body and with the mouth. One important point, though, is you've got this chronic infection or inflammation in the mouth that isn't seen unless it's looked for using certain tests.
So what specific tests are being done maybe to find out what's going on in the mouth?
Okay, well, let's look at it this way. Everyone knows about strep throat or a sore throat. What do? You go to your doctor and they do a culture, right? Because your gums get red and inflamed the same way your tonsils get red and inflamed. So in the sustainable dentistry practice, what we do is we can take a little sample under the gums of the bacteria. And then we can look at it and identify if the bacteria is good or bad. And if it's bad, then we put together a certain treatment principles to address this chronic inflammation. If someone has a breakdown in their gums, but there's no bacteria, then what do you do? Well, then we say, well, maybe there's a nutritional deficiency going on. So now we know to have that conversation with the patients. And that's pretty much what we do.
That's wonderful. And so how important would you say nutrition is to your overall dental health?
Well, if you don't have proper nutrition,
Yeah.
you don't have your immune system is compromised, you don't have the building blocks for the body and the mouth to heal itself. So nutrition is really important, and it's important to have good antioxidants, good minerals. You need a good foundation in order for the body to recognize and to grow strong so that you can reverse the diseases of the mouth. So if someone, let's say, has gum disease, and they're told that they're losing their bone, right, and they're told they need gum surgery. Well, if you identify the bacteria, you put in the proper nutrients, you can see that this disease goes away on its own, and the patient then doesn't need to have the surgery. And in the future, they can now sustain it because they know what they need to